Got it. Okay, good morning, everyone. I would like to introduce you to Dr. Feehan. He is a dentist at Illini Dental in East Moline. Thank you so much for joining us this morning. Why don't we go ahead and just get started and jump right into, tell us about your job. Tell us, what kind of education, why you chose this line of work, what students can do now to prepare for a role as a dentist.
Sure. So I have been a dentist for now 14 years. And after high school, I did 4 years of college, and then I did 4 more years of dental school. And then I've been working in private practice since. I had 3 relatives that were dentists, so I was always a little familiar with the field. And I enjoyed math and science. And, I thought about a career in healthcare, and I like the idea of being able to have a relationship with different patients on a pretty consistent basis. I like the hours where there weren't, evenings and weekends and call. I enjoy, being able to make a small but important difference in a lot of people's lives. It's not life or death. It's pretty reliable work. And that was a lot of the big reasons why I thought dentistry would be good for me. Again, I kind of arbitrarily decided when I was 15 years old that I wanted to be a dentist. So I just stuck with it. When I got to college, I talked to my college advisors, let them know what I wanted to do. And I took the appropriate classes. I did an internship actually at the office that I work at now. This is one of the practices that my dad's cousins had started. And yeah, just applied to dental school and wrote it out.
So what is it that let's go back. What's your daily schedule look like?
Yeah, no, it's great. So I work Monday through Friday, which for dentists is a lot. We do see patients from 8:30 to 5 Monday through Thursday, with a lunch from 12:30 to 1:30. And then Fridays we work from 8:30 to 2 when we don't take a lunch, just so everyone can get done a little bit earlier for the weekend. But again, for me, it's, I have my own schedule where I do restorative dental work. So whether it's fillings or dental extractions or root canals or crowns, or bridges or implants, all of my stuff is its own schedule. And then we also have 2 or 3 dental hygienists working at a time. So then between my partner and myself, we have the responsibility to do the dental exams when people come in for their regular 6-month cleanings and checkups. So it's kind of a juggling act, being able to be in one of several places simultaneously, but it's fine. I like it. So keeps me on my toes.
So I have a strange question to ask. It's funny to always hear people say, I hate going to the dentist because they always ask me questions with, their hands in my mouth and all of that. Sure. And so that definitely is obviously a little bit more about the hygienist piece. And you kind of touched on what role you had, but can you kind of explain the difference between those 2 roles? So if I'm interested in teeth,
no, that's a great question. So really within my office, there's actually like a handful of different employees. So we have the women that work up in the front, so reception, the insurance, the billing coordinator, things of that nature. And then there's dental assistants, so they help the dentist themselves. So I have 3 different assistants, and I have 2 with me at a time. So they're really, really important to my daily life. So not only do they help me clinically, like in the operatories, there's a lot of little auxiliary things that they do that would make my life miserable if I didn't have them. So I'm very, very appreciative of them. And then the 3rd group would be the dental hygienists. So they are the ones that do the dental cleanings. So dental assisting, there's programs that you can take that are offered in many different places, in fact, and a lot at the community college level. And then additionally, dental hygiene, there's a year generally of prerequisites that often are taken at a community college. And then the program for dental hygiene is another 2 years. So you're looking generally, if you did things straight through, like a 3-year commitment after high school. Dental hygiene is historically rated as one of the best careers to have. It has a pretty good earning potential. Again, the schedule can be as much or as little as the actual hygienist wants it to be. There's a lot of benefit to that. And then again, lastly, for dentists, there's the undergraduate requirements and then the 4-year programs. And then of course there's dental specialists when you're talking about oral surgeons and orthodontists, and gum surgeons, and root canal specialists, and and pediatric dentists. They all have extra training afterwards, but that's the gist of things. So great question. And yes, lastly, I try to avoid asking any kind of question that's more than a no or yes answer if my hands are near their mouth.
Yeah, we appreciate that too, by the way. So what's the thing about your job that you like the most? Like, what's the procedure? Somebody comes in and you get excited because you get to do it.
Great question. So I enjoy most of the things that I do, thankfully, which again lends itself well since I do this every day. But I get a lot of satisfaction about being able to work with 2 main groups, and oftentimes they're one and the same. So those that are really anxious, I think that my staff and I can do a very good job with people that are super nervous, that are really uncomfortable, and just making the experience as positive as we can. And then secondly, I really enjoy being able to help people that present with some sort of emergency and like a toothache or a traumatic event, and being able to help them be comfortable and get out of pain. So that does mean a lot of root canals and extractions sometimes, but that's okay. People don't want to be suffering.
I love that, because you do hear, like I said, not only do you hear they always ask me questions when their hands are in my mouth, but then you always hear, I'm most scared of the dentist, right? So I'm sure you do get a lot of people who are very anxious. And so
every day I hear, don't take this personally, but I hate coming to the dentist.
Yeah.
So we usually tease them back about that. But yeah, I mean, it's an assumption that is safe to make about every single person walking in the office, is that there is going to be some level of fear or anxiety or uncertainty. And, if we treat everyone with a little additional patience and respect, it goes a long way.
And
I tell you, Erica, his staff is absolutely fabulous, because my kids have been going to him since they were very little, and my kids have never had a fear of going to the dentist. So
I love it. Well, that's good to know though, because you think about, okay, I'm going to go into dentistry, I'm going to go into some form of healthcare or something where you're immediately dealing with people, and you have to remember that people part, right? So you might be really good at what you do, but you have to remember the people part.
100%. That legitimately trumps everything. And I guess circling back to what I like about dentistry, I do enjoy being around people, and I think that gives me an opportunity to, again, be a small part of a lot of people's lives and make something that's inherently awful for them, a little less miserable. So that's how I guess I base a lot of my experiences is, how little can I make it suck for them?
yes, absolutely. So what's the worst part about your job?
I mean, again,
everybody has a bad thing. Everybody has a bad thing about your job.
No, I mean, for me personally, I feel like 99% of what I do is amazing. Probably the 1% that can be challenging is, again, my partner and I are small business owners. So there are different things, outside of dentistry that we are responsible for. And, I think often, anytime there's conflicts with staff or, problems, with different things that are kind of secondary to our work, that can give me some grief. So, it's really important that we're, judicious in who we hire to make sure that they're a good part of the team, and being able to have our different groups within the office be able to coexist and work together as a team. So, the values that you learn in sports and in the classroom about teamwork are things that you will carry with you, through the rest of your working life. And that's important for all the students that are going to be kind of listening to that, is just, get comfortable being able to not only coexist, but to be able to get along well and thrive with the people around you, regardless of what you think about them before you start, because you'll have a lot more in common than you think you do. And that helps, strengthen your bonds and helps everyone, work more efficiently and happier.
So I'm glad that you brought up that you have your own practice. So did you need to take business classes or?
I love that you asked that. That's the irony. No, I've had exactly zero business training in my life. But again, I think that, if you can follow a lot of just general guidelines regarding, just the treatment of people and of your staff, that can resolve a lot of the more nuanced things. Obviously, we have a lot of accountants and, professionals, legal team, for little things behind the scenes, but, we even have like an HR company that we can use should we need them. But realistically, my partner, Corey, and I handle almost everything. So again, I'm probably woefully ill-equipped to do it, but it's something you learn and try to get better as you do it longer.
Great. Erica, do you have any more questions? Because I know you have patients that are going to be here very shortly, so I don't want to keep you any longer than we.
I just have one really quick question.
Please.
So
Yeah.
do you specialize in a certain age group? Is your facility open to everybody? Can you specialize? Like if I know that I'm going to be better suited for working with younger kids, can I do a pediatric?
Great question. So again, our practice is general dentistry. So, our age range is, from 0 to technically, like 100 or, someone's even older, but, again, some people need to be seen in specialized clinics, whether it's the teenager that needs their wisdom teeth removed, we'll refer them to the oral surgeon so they can be put to sleep. The teenagers or adults that want to get braces, we can refer them to the orthodontist. But lastly, the group of young children or maybe patients that have too complicated of treatment. I just had a little boy that was 4 yesterday and he had at least 6 cavities and they were all big and he was sobbing before he'd come in. And, the idea of being able to give him the treatment that he needs would be very challenging for him or myself. So I did write him a referral for the pediatric dentist, but, I'd say at least 95% of the kids we see, I'd like working with children because again, most of them are blank slates unless they've been influenced by like an older sibling or, a parent. But if you can walk them through what you're doing and make it not painful or not surprising to them, kids consistently impress me how well they do. And then they're great the rest of their lives. So again, that's another thing that I get a lot of satisfaction about is establishing those positive experiences for, children and adults and even sometimes, I guess, undoing the past traumas that older patients have had because dentistry was a lot rougher, I guess you would say, in generations past.
And you do have lots of really cool toys you get to play with.
Are we talking like toys out of the treasure chest or like my actual working instruments?
Okay, well, both, because my kids still, even though they are teenagers, go to the treasure chest, but I've seen lots of really cool toys that like advancements in dentistry that you've had over the years that, I didn't see when I was a kid, but I see using on my kids now. So
absolutely. Yeah. Again, as dentistry gets more sophisticated, I think it makes it gentler and an easier experience for patients, which again is the goal. We want it to be as straightforward and uneventful for patients as possible. Anyway, thanks so much for having me, everybody.
Thank you so much. Like I said, I know you have patients to get to, so I don't want to keep you any longer, but we really appreciate you taking time this morning to talk to us.
Oh gosh, my pleasure. If anybody has any really big questions, feel free to reach out and they can pass along the information to me. I'll be happy to help.
Awesome. Thank you so much.
Thank you. Have a great weekend.
You too.
Bye-bye.
Bye.